Good day. I am Angelo L. Castillo, your instructor for today. And this is our asynchronous discussion, and our topic is temperature taking via axillary site. And for the objectives, first is to understand necessary terminologies for temperature taking, know the advantage and disadvantages of axillary temperature taking, and demonstrate proper procedure when taking temperature via axillary site. But first, let us define some terms. First is thermoregulation. This is the ability of one organism to keep its body temperature within certain boundaries. Next is febrile or fever, and the fever word it is common. And its definition is body temperature above normal range. And if you're going to ask me what is the normal range for body temperature, it will be 36.0 degrees Celsius up to 37.2 degrees Celsius. But in some references, it do varies, but yeah, we will be following in our class that the normal body temperature range is 36 degrees Celsius up to 37.2 degrees Celsius. Next is a febrile or the absence of fever, body temperature that is within normal range. And just like what I've said earlier, the normal range for body temperature is 36.0 degrees Celsius up to 37.2 degrees Celsius. Next is hypothermia. This is the body temperature when it decreases below normal. And according to what I've said earlier, 36 is the lowest value. So anything below 36 is considered hypothermic or hypothermia. Next is hyperthermia. This is the body temperature when it increases above normal. And just like what I've said earlier, the maximum value for the normal value of our body temperature is 37.2 degrees Celsius. Anything above 37.2 degrees Celsius is considered hyperthermic or hyperthermia. And also, we do need to take into account the surroundings of the patient or our surroundings when we are checking the body temperature using the axillary side because it can affect the values. And also, another thing to take into account is that there is a certain time of the day where the temperature increases, especially in the afternoon. So take note of that. Next is thermometer. This is an instrument used for measuring body temperature. And the type of thermometer that we'll be needing today is a electronic thermometer, which is used for the axillary side or the underarm or the armpit. But before we proceed, I do have a question here. Why is it necessary for us to know how to properly measure body temperature? Yes, body temperature taking is quite simple and easy to do at your home, but the reason is that there are little things that we do that clearly affects the reading of a thermometer. And especially today, we are against a pandemic where its common symptom is fever. And for us to know if we have a fever, we do need to take our body temperature. And to minimize the error, we do want to properly do the step by step process or procedure in body temperature taking. And today, that is what we are going to do. I'll be teaching you how to properly measure body temperature via axillary site. And for the advantage and disadvantages, first for the advantages. Safe and inexpensive. Safe in a way that it is non-invasive compared to the other methods of taking body temperature, and it is inexpensive because what we only need is an electronic thermometer for the armpit, and alcohol, tissue, and cotton. And for the disadvantages, first is the length of time it takes before this can read the body temperature. Sometimes it takes 30 seconds or even a full minute. Next is the placement may affect the result. When using this, there is the right position for it at the middle of the armpit. And if you place it off, or if the one who is taking the body temperature failed to hold it in place, the result will be affected. And lastly, it is the least accurate type of measuring body temperature compared to the other methods. And if you're going to ask me what is the most accurate body temperature reading or method, it is via oral. Second is via anal or indirectum. And that's it for the advantages and disadvantages. And here are the things that is needed when taking body temperature. First is an electronic thermometer, alcohol, cotton, and tissue or paper towel. You can also use this kind of swab, alcohol swab, and that's it. That's the materials needed for taking body temperature via axillary site. And now for the step-by-step procedure on how to properly take the temperature via axillary site. First, get an electronic thermometer, which usually comes with this case, alcohol, cotton, and tissue or paper towel. Next, disinfect the hand. Disinfect the hand and the thermometer. Take it out of the case. Then wipe the tip of it, just like this, up to the handle. Now that's done, you can lift the desired arm. But before you place it, check for lesions, open wounds, and any type of wounds or bumps, growths, masses. Because if these things are present, or any of these things are present on your armpit, do not proceed. And next, if it's wet, pat it dry, just like this. You should not wipe it like this because it will create friction. It can affect the temperature reading. After that, after making sure that the armpit is dry and there's no lesions or anything, place the tip at the middle of the armpit. Remove any article of clothing that may block the tip. Place it at the middle of the armpit and hold it in place. After placing the tip at the middle of the armpit, turn on the thermometer and hold it in place. May it be by squeezing your arms or just holding the thermometer there for, and then wait for it to ring. And When it rings, check the thermometer, and after that, disinfect again. But now you will start with the handle, and then to the tip. After disinfecting it, put it back to its container, and that is how you properly get the body temperature via axillary site. And to further enhance your understanding, we have here a video which I prepared, and enjoy watching. So ngayong araw po, kunin ko po yung temperature nyo. Mamaya po, papakiwasan ko yung taas po itong manggas ng ano nyo, t-shirt nyo. Mamaya po. Kaya lang po. Tataas niyo po ito. And then, lalagay ko po yung thermometer ito para makuha po natin yung temperature. And then, mag-aantay lang po tayo ng mga ilang minuto. And tayo po natin tumunog yung thermometer para makuha po natin yung temperature nyo po. Okay. Prepare ko lang po yung thermometer. Then, we'll be cleaning it from the sensor to the body to the top. Pwede po natin itaas yung gas. Wait lang po tayo ng ilang minuto. Then po natin tumunog yung thermometer. Okay po. Ito po masyadong malito. Yung temperature nyo po is 36.2. And kasi po sa edad nyo, normal naman po. And that is the end. That's it. That's the end of our discussion. And if you have any concerns or any questions, just comment down on the comment section. But for next week, you have an assignment. You'll be creating a video where you will be demonstrating proper temperature taking via axillary or underarm site, and its deadline would be next week, the day before our weekly discussion. And I guess that's it. See you next week, and goodbye.